Hey everybody, it's Mark Bukowski here from my lovely hotel room in New Orleans. I'm about to get ready to go to my conference, so I got to try and make this brief. So anyway, today's learning objective that I have is exercise stress test. So this was originally developed in 1963 by Robert A. Bruce, and it's known as the Bruce Protocol. This is a treadmill-based test, and it's used to exhibit moderate heart dysfunction, predominantly coronary artery disease. So the patients that you're going to want to consider for something like this would be patients who have symptoms suggestive of coronary artery disease, people with significant risk factors such as hypertension, hyperlipidemia, diabetes. You're going to want to evaluate patients who, for instance, are asymptomatic when they're regularly walking on the street, but all of a sudden they play a basketball game and they faint. And you're going to want to evaluate hypertensive patients as well as patients who may have irregular heartbeats at exercise. So anyway, what you're going to use is you're going to use a 12-lead EKG, a blood pressure cuff, and pulse ox. So what you have the patient do, as far as the procedure goes, is do not eat or drink 3 hours prior, have them stop their pain meds 1 to 2 days prior, and have them wear comfy shoes. They're going to be on a treadmill. So test may take 1 hour. So how it starts is you have them go slowly on a warm-up on a flat plane, and then with every 3 minutes, you're going to increase the speed as well as the slope of the treadmill. So this way you're going to kind of represent how they function on a small hill. Anyway, so every 3 minutes it's considered a stage. And for instance, stage 1 is 10 degrees or 10% increase in the treadmill. And it's going to be going at 1.7 miles per hour. Stage 2 is a 12 degree slope with 2.5 miles per hour. For instance, stage 7 is at 21 minutes. It is 22% slant or gradient slope with 6 miles per hour. So as you can see, this can take a while, and if your patients are physically fit, then this could definitely take longer. Anyway, so what your objective is to hit the patient's target heart rate, which is 85% of their maximal heart rate at their predicted age. But if the patient shows any symptoms or is at any sort of risk, stop the test immediately. It's not worth it. So if they're short of breath and they're feeling fatigued, you're going to want to be careful at this point. Blood pressure readings are about every 2 minutes into every stage, but the EKG is reading the entire time as well as the pulse ox. Now, this test is subjective based on how physically fit or healthy your patient is, as well as those who are working with machines. So it is subjective, but it is somewhat reliable. So it is able to diagnose coronary artery disease 67% of the time, which is pretty good. But the accuracy can decrease if there's a single narrowing, and the accuracy can greatly increase if you have, for instance, all 3 main branches of your left coronary artery blocked. So overall, the main issue here with the exercise stress test is that it has a chance for false positives, which is 10% of the time. But this has constantly been used. It's been modified. This is the original. This is what you're going to see most of the time. So Bruce Protocol, exercise stress test. Definitely test your patients out. Good luck. Hope you all have had fun. Hi, Dr. Mabe. Hi, Dr. Fisher. And take it easy, y'all. See you next week.